I think where you need to start is the difference between a psychiatrist and a psychologist. I think these are very important professions, but they're same, but different, especially in the United States. So the major difference between a psychiatrist and a psychologist is that a psychiatrist is a medical doctor. You know, like when someone on the plane is having like a heart attack and they're like, oh, is there a doctor in the building? This is your captain speaking. Can you please, if anyone is a doctor in the house, can you please come to the front of the cabin? That's like the medical doctor. I mean, I can go. If there's a doctor in the house, can you please make yourself known? I can make myself known. Hi, I'm a doctor. And when I get to that person, I'll probably be like, yo, man, how you feeling? And they're probably like, I'm feeling really bad. But I'll be like, no, how does that make you feel though? Like that's about the most support I could probably give that someone in a medical emergency. Now, if they're having a mental health crisis, maybe that'd be something different, but a medical emergency, I am not that kind of doctor. Not at all. So a psychologist, it's a clinical degree or like a academic degree. That's basically the difference between a PsyD and a PhD, is that a PhD and a PsyD, the way that they're different is a PhD basically creates new knowledge. So they're creating new measures, they're running studies, they're writing articles, they're living in academia. Those are PhDs. Those are professors or whatever. Now, that's not meaning I couldn't be a professor, but their training leans itself more into academia. Now, that doesn't mean that a PhD can't do clinical work and a PsyD can't do academic work, but again, the emphasis in their training, that's what we're talking about. So a PhD, academics creating new knowledge. You can also equate a PhD for psychology like a PhD in biology. Both a medical doctor and a PhD in biology know how the body works and runs, but a PhD in biology is not doing surgeries or working with patients. Instead, a PhD in biology is probably doing bio research to create new techniques or whatever to help doctors who are doing the practical work do their work better with their patient. The same way, a PhD in psychology is creating new measures or information or knowledge that the clinician PsyD can use with their patients or their clients. So me personally, I have a PsyD, so I have a clinician's degree. And so my specialty is in the diagnosis, education, prevention, but basically working with people to help them get better. That is in my wheelhouse, my training. So major differences: medical doctor, psychiatrist has understanding of the brain and how it works, the biology of the body, and their main job and function is to provide a diagnosis through their medical lens and provide medical things like drugs. I cannot prescribe drugs. I would have to work with a psychiatrist to send you my patient or a client as a referral to them, and then we'd work together with the med management and the behavioral changes, which would be my specialty. Again, that's not saying that psychiatrists don't also do the therapy one-on-one work. They can, but like I'm saying, their training is more apt to the biology pills and medications and psychotropics and giving you the medications that's going to give you different effects psychologically for depression, anxiety, ADHD, those types of things. That is what psychiatrist does. Me, psychologist, behavioral skills, those types of things, that's what I work on.